This Spotlight on Employee Benefits is sponsored by Colonial Life, helping you help your business. For more information, please visit coloniallife.com. Approximately 30 million women will benefit from the new healthcare reform law over the next 10 years, according to a recent report from the Commonwealth Fund. The report says that the law will help to stabilize or even reverse women's growing exposure to increasing health costs by subsidizing health insurance for approximately 15 million women who currently have no health insurance coverage, and by strengthening existing coverage for an additional 14.5 million women who are underinsured. The authors found that provisions pertaining to women included expanded eligibility for Medicaid, provision of subsidies to purchase health insurance, limiting out-of-pocket expenses, preventing insurance providers from charging higher premiums or turning down coverage based on gender or health status, and mandatory new plans to cover pregnancy, childbirth, and newborn care. In addition, the Pre-Existing Condition Insurance Plan, or PCIP, is a key provision that will aid approximately 100,000 currently uninsured women with pre-existing conditions in getting provision coverage. 25 members of the House recently asked federal health regulators to guarantee a role for licensed insurance agents in a new web portal that will be used to help consumers compare coverage options. The web portal was unveiled by the Department of Health and Human Services last month on a trial basis, with more comprehensive information scheduled to be added on October 1st. The portal is considered a precursor to the health insurance exchanges that will be launched in 2014 as part of the Patient Protection and Affordable Care Act. According to the letter from the House members, quote, "We strongly encourage you to include the ability for consumers to contact certified, state-licensed independent health insurance agents and brokers for assistance when comparing coverage options. It is important that consumers' options to contact independent and state-licensed health insurance agents and brokers be included no later than October 1st, unquote. The letter was signed by 8 Democrats and 17 Republicans. The letter added, quote, "It is our belief that consumers will benefit from this arrangement and will respond positively to the new portal method of purchasing health insurance if they are able to access the personalized service of an insurance agent or broker." The Federal Patient Protection and Affordable Care Act, or PPCA, could hurt small U.S. health insurers, causing many to withdraw from the market, be acquired by larger insurers, or even fail completely, according to a recent study by Weiss Ratings. After studying nearly 600 U.S. health insurers, Weiss gave 95 a rating of weak or lower, meaning they could be vulnerable to future financial trouble due to higher medical costs, a weak economy, or other factors. According to Martin D. Weiss, president of Weiss Ratings, certain provisions included in the PPACA, such as the removal of certain reimbursement limits and mandated coverage for pre-existing conditions, will force health insurers to spend more on medical care. Quote, "Most large health insurers will be able to handle it, but we are concerned that weaker, less profitable insurers will be forced out of the market, reducing competition and ultimately leading to fewer choices and higher premiums for consumers," Weiss said. In addition, the rating agency gave 186 insurers a rating of fair, saying these companies would struggle to absorb additional costs stemming from PPACA. Finally, Weiss said that large insurers with abundant capital and solid profits are expected to absorb increased expenses from PPACA and could potentially expand their market share through the acquisition of struggling companies. For more industry spotlights, visit producersweb.com.